So one of the realities at dance prehab is operate with the dancer who is often in competition or rehearsals or auditions, summer intensive prep, school shows. It's a lot to manage. When I'm thinking about giving exercises, it's not just you have knee pain, do some hip activation, do some glute exercises. I'm interested in what your schedule is like. It's not responsible for me as a healthcare provider to say, you need to do these jump exercises on like a busy, heavy week. What's the minimum amount that you need to do in order to heal, but also continue to perform? That's the gray area that we're never not balancing here at dance prehab. When I'm thinking about someone's exercise program, my first question is, what are you doing? What are you doing? What are we leading up to and how far away is that? So if someone has a show in 3 weeks, if someone has an intensive in 2 months, everything from day one and week one begins to build to that moment. So whatever that moment is for you, I want to know. The second thing I'm also interested in is, what does your week-to-week schedule look like in terms of rehearsals? I want to make sure that I can match your exercise program to how much you're doing. If you have a high load of rehearsals for 1 week, maybe we bring down the exercises a little bit and we find the ones in our toolbox that are going to be most effective for you when you have so much going on. If you have a lull in your rehearsals, great, you're not having to think too much. Can we bring up some of those other exercises? And then in this time, we're always talking about what the exercise response is to you. If there's an exercise that we're doing and you say, hey, this feels great, solid, let's keep it going. If there's an exercise that maybe doesn't feel so great when times are so busy, how do we pull that back so you can still be effective with your healing? Or maybe we replace it with something that's going to give the same kind of stress, that good healing stress, without overloading your overall body. The third thing is just going to be your life. Are you sleeping enough? Are you eating enough? How do all of these things play into how we can give your body the healing stress that it needs? So when I'm thinking about an exercise program, it's not just about this exercise for knee pain, this exercise for hip pain. It's how do these movements and these healing stressors ebb and flow with your dance demands, your training demands, and your demands of being a human.